But we begin with 4 years ago today. And that is when the World Health Organization declared COVID-19 a global pandemic. It has killed more than 58,000 Canadians and at least 7 million people worldwide. The severe peak of the pandemic may be over, but the infection is still around. The CBC's Lauren Pelly tells us who should be most vigilant about getting boosters.
COVID-19 can be characterized as a pandemic.
4 years after that declaration from the World Health Organization, COVID is still on many Canadians' minds.
It doesn't feel like it was 4 years ago, but I mean, I'm happy that we are where we are.
I think that was a very powerful impact on people's life.
I just don't want to get sick. I got races to run, so just can't get sick.
Researchers say staying up to date on COVID vaccines remains one of the best ways to protect yourself. And a new American study suggests more frequent vaccination for high-risk populations like older adults and anyone immunocompromised could help reduce the burden of severe illness.
It becomes less about the number of doses you've gotten and more about the time since your last vaccine dose or infection.
The study's co-author says protection wanes over time, leaving higher-risk groups more vulnerable.
If you just look at the data on severe disease and who's being hospitalized and dying right now, it's almost the same pattern that's been present the entire pandemic. And I think that's quite striking.
Canada's overall COVID death rates have dropped dramatically since 2020, but older age groups are still bearing the brunt, with 9 in 10 total deaths among those aged 60 and up.
I think we'll see new guidance.
This Canadian immunologist expects a spring vaccine push here for higher risk groups, since COVID is still circulating year-round, at least for now.
I suspect we'll get to a place where it's more seasonal than it has been.
Scientists do remain hopeful that COVID will become less of a threat over time, but for now, it's still sending some Canadians to hospital and leaving others with lasting health impacts. Official guidance from Canada's national vaccine advisors: high-risk Canadians can get another spring dose. Lauren Pelly, CBC News, Toronto.
No one knows better what it was like 4 years ago than those on the front lines. Joining me now is a nurse who was there during the beginning of the pandemic. Eram Chhogala joins me now from Toronto. Appreciate you being here. Looking back at this day 4 years ago, what memories stand out most to you?
I would say that it would probably be how challenging and how crazy the emergency rooms were, how packed they were, how much fear there was, amongst my colleagues and myself, fear of the unknown, how worrisome patients and families were, and just how many patients just kept coming in through ambulances, how short of breath they were getting, how we had to place them on life support because they couldn't breathe, and how short of breath they got. And what I also recall is how there was no room left in the ICU. So we were sending patients out to other hospitals, in different areas of the city or to different cities because there was absolutely no room to accommodate sick patients.
Were you, obviously when you were in it, you were, doing your job, you were doing what was needed to deal with patients, but were you also concerned about your own safety at that point? Talk to me about that.
Well, absolutely. Seeing the ramifications of COVID-19, seeing that people were short of breath, seeing that they couldn't breathe, and how it afflicted so many people, regardless of their age group, did make me feel fearful for myself, but also for my colleagues and my family and everybody else.
And speaking of your family, I know, you mentioned to my producer that this has affected you personally. Tell us about that.
So, unfortunately, my father became victim to this disease, and while he followed all guidelines, he still ended up sick. And he fought a very long, hard battle for 1 month in the ICU, and COVID took his life.
Emotionally, what was it like, caring for your patients after your dad had passed away?
For me at the time, I would say that I was still, taking part in doing my very best as a nurse and caring for patients with COVID-19. But at the same time, I understood and I could heavily empathize with patients and their families more so because I knew what it was like to be on the other side. Rather than just being a healthcare professional, I understood what it was like being a family member.
What kind of, you talk about PTSD, and I remember back to that time just watching the images of from the outside of the hospital and then seeing, bits and pieces on social media of what it was like inside. Does this still stay with you? And how have you been able to kind of mentally cope with the stress of everything that you went through?
Well, it definitely has not left my mind. We still reminisce on it. My colleagues and I, especially myself, I do reminisce on the times where I recall having to see patients come in and how sick they became, and even just personally how it afflicted myself and my family. And just those images, and just even remembering a lot of moments and a lot of the times that I've had to endure during that time period. In terms of how I've been coping, I'm very much into, a lot of meditation and spirituality. So I think that that's what helps me kind of center myself as a person and helps me have a more optimistic view on life.
When the pandemic did start, everyone, if you'll remember, a lot of people were banging pots and pans. They were cheering. They were celebrating healthcare workers on the front lines. Do you still feel that appreciation, or did something change along the way?
I feel there's probably a small piece of appreciation, but I do think that there's been a lot of changes. In the beginning, we were saluted as healthcare heroes. People were banging their pots and pans, as you stated. But then, we were experiencing a lot of backlash from the community and a lot from people in the city. We had people protesting outside of hospitals, people that became resistant to getting vaccines or even wearing a mask coming into the hospital. The physical and verbal assault towards healthcare workers and those that worked in the emergency department. And, we also can't forget the trucker convoy that was also in part of that. So I feel like there was definitely a drastic change along the way. And even until today, sometimes we still do experience a lot of violence towards healthcare workers in the emergency department.
Do you think that Canada is better prepared now than we were at the start of this 4 years ago if another pandemic were to hit?
I really hope that we've taken that step back to evaluate what we could have improved on, because prior to COVID-19, we had SARS, we had so many other pandemics that we encountered. And I think that we should have definitely taken COVID-19 very seriously. And I think that we should have been considering that as our reality check to say that, this is what we need to do now. We've experienced these pandemics, so now this is what we need to implement. So I think that this should be a great lesson learned if we are to encounter a future pandemic. But I don't think that we'll always be prepared, because viruses are always evolving and changing. So we might be prepared, but we may not always be fully prepared.
Eram, appreciate you coming on today on this very grim anniversary. That is Eram Chhogala. She is a nurse who joined us from Toronto.